Hello and welcome. In this video, we'll go through a step-by-step process for doing injectable composites using clear silicone indices with 3D facial planning. So let's get started. Here's the pre-situation of the patient. The patient underwent a trauma few years back and lost his upper left central incisor in the process and now decided to do something about it. Though it's a discussion for some other time, in this case, it was decided to go ahead with the bridge from 1-1 to 2-2 and injectable composites on the rest of the teeth from canine to canine to improve the overall smile and proportion. So we got the 3D facial planning done, and this is what the DSD frame looked like, giving an idea about the gingival correction that would be needed. And to communicate this with the patient, we laid it out in a lovely presentation format for the patient and showed it to the patient as follows. Once the patient is on board, we will directly fast forward to the injectable part of the case. If any of you guys are interested in checking the whole journey of the gingival corrections and other things, leave a comment below and I would love to make a video taking you through the whole journey. As you can see, the patient is very happy with the test drive. So we start our journey with the injectable technique now. It is assumed that the patient's functional test drive is done and the final model is 3D printed and a clear silicone index is kept ready. So let's begin with our step-by-step of the true procedure for doing injectable composites. We start by using good retraction achieved by Optragate in this case, but you can use something else if you're comfortable. The second step is removal of the biofilm if at all present on the teeth. We are using a mixture of pumice and glycerine with a polishing brush in this case, or an oral prophylaxis brush. But if you have an air abrasion unit, that would be an absolute ideal way of doing this. The next step is to isolate the adjacent teeth using a Teflon tape. This is done to create a perfect flossable contact while we inject the composite. The Teflon should be very intimately covering the adjacent teeth both from the buccal and the palatal. Once done, we can start with the first step of bonding process, which is the etching of the enamel. As this is a fully additive case, we are going to go prepless. We then start with thorough rinsing off of all the etchant from the buccal and the palatal. Once done, air dry it, but not to desiccate it and to keep it gently moist. As such, we are in enamel, so there is no worry. And we start with the application of the dental adhesive. In this case, we are using a 7th generation bond on a very clean paint brush. The paint brush makes it a little bit more easier when you're doing a lot of teeth at a time to apply the bond and then scrub it very well as compared to a normal applicator tip. Next step is to evaporate the solvent using a 3-way syringe and then cure for a stipulated period of time. Once the bond is cured, this is the most important step. You need to change the Teflon with a fresh pair of Teflon, which is going to make sure that while or once you have injected the composite and cured it, the Teflon comes out very easily. Do not skip this step. Always change the Teflon after you have cured your bond. Once done, we place the clear silicone index in its place and firmly press it in position to make sure that it is seated completely. Take your injectable composite and through the hole that was created beforehand, you insert the needle of the injectable and start injecting with one thing in mind, that once you have placed it in position, just go ahead and keep injecting and avoid inserting inside or removing the injectable out when you are injecting, and completely finish injecting the composite. Once you can appreciate that the entire tooth is filled with the material, keep the pressure firm, do not increase or decrease the pressure, and then go ahead and tack cure it, maybe about couple of seconds, 5 to 10 seconds from buccal and 5 to 10 seconds from palatal, and then remove the clear silicone index, and then start removing the excess flash or excess material at this partially cured stage. As the composite is softer, it's a little bit more easier to remove the excess from the tooth and do the initial finishing at this stage. And the best instrument to start this excess removal is a sharp, fresh 12 number blade on a BP handle. So you take that and you start removing all the excess in and around the gingiva. We then try to fit the temporary bridge back into the patient's mouth. Since the fitting is satisfactory, we remove that and we proceed with finishing and polishing of the interdental contacts of that particular tooth. So this is done using the finishing strips generally available for the interdental contacts. So you start using the medium grit followed by the fine and then the super fine grit on both the sides, mesial and distal sides. Once done, then we can start or proceed with application of the KY jelly to remove the oxygen inhibition layer and go ahead with the final curing for that particular tooth. Once we are done with the final curing of the composite, we then place the old provisional bridge back into the patient's mouth and then rinse off all the KY jelly thoroughly and start with the bonding or the injectables for both the canines simultaneously in one go. The first step being isolating with Teflon tape on both the lateral and the first premolar on either side, and then repeating the exact same steps right from etching to bonding to changing of the Teflon tapes to placement of the clear silicone index after placing the new fresh Teflon tapes, and then injecting the material, gross finishing, final finishing, and then polishing all of them together. So enjoy the video in a hyperloop way, and then we will take up the polishing protocol for the same. The best part about injectable composites is it requires very minimal finishing and polishing. So if done correctly, all you need to do is remove the gross excess, finish the contacts well. You have a lot of opportunities to run your finishing strips and polishing strips interdentally to give a beautiful interdental finish and polish. Once done with that, you start with the gross process of finishing, which is by using any form of medium finishing disc. In this case, we are using a 3M Softflex finishing disc, which is the medium one. The course is not required because you do not have to get any major morphologic changes in this. Then the second step is using the rest of the two discs, which is the fine and the super fine, in that order. Once you're done with that, as you see, once you have removed the majority of the excess, then you only have to do some gross finishing, and then it is just followed up by the final polish. So once you are done with using the medium disc, you move to fine and then super fine finishing disc of Soflex. Your 90% of the luster and shine and the final polish is almost ready at this stage. Once you have completed these three discs, once done with that, you just move on to the aluminum oxide or diamond polishing paste of your choice with a felt buff at a slow speed with intermittent irrigation to finish the polishing. And once you're done with that, this is the kind of final result that you can expect. Once you're done with the buccal surface, do not forget to finish and polish the palatal surface using any simple silicone disc. Generally, there is very less excess that you have to finish. So a simple silicone disc is more than enough to get a very smooth surface on the palatal. A little fast forward in time, and this is how the final product looks like after cementing the final prosthesis. This is a close-up view showing the perfect integration of the soft tissue with the restorations, and this is the final smile showing the perfect integration of 3D facial planning onto the patient's face and a combination therapy of indirect bridge with injectable composites. If you found this video helpful, feel free to share it with someone for whom it can be of some help. Feel free to like and subscribe to our channel for many such videos on everything dentistry. Signing off, Dr. Mayank Doshi. Thank you.